Assalamu alaikum. Now, it's a long one. I haven't made any sort of video. Now, today I would like to discuss about the musculoskeletal system. In musculoskeletal system, first I would like to talk about the rotator cuff. This is rotator cuff. In rotator cuff, there is four muscle: supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus in the suprascapular fossa, infraspinatus, teres minor, and subscapularis. In supraspinatus and infraspinatus, both of them is supplied by suprascapular nerve, and teres minor is supplied by the axillary nerve, and the subscapularis is supplied by the subscapular nerve. Okay, in supraspinatus, we have to know the action done by this muscle. In supraspinatus, actually abducts arm initially. Abduction. This is abduction. Abducts arm initially. This is abduction. And if there is injury to the supraspinatus muscle, if there is injury in the supraspinatus muscle, if there is a rotator cuff tendinitis or rotator cuff tear, and the involvement happens in the supraspinatus muscle, then we can figure it out by doing a test called MT or full can test. MT or full can test. This is done by abduction of the arm, then 30-degree forward flexion, abduction, 30-degree forward flexion, then internal rotation. That means thumbs down. If you do this, and if there is tenderness or if there is pain over the deltoid region, then you can say that the involvement of this supraspinatus muscle. And next one is infraspinatus, which is also supplied by the suprascapular nerve, but the function is different. Infraspinatus externally rotates arm. Infraspinatus actually externally rotates. Infraspinatus and teres minor, both of them actually externally rotates arm, and this happens during pitching injury. Pitching injury means like if you play baseball, uh, the person who throws the ball is called pitcher, and it happens in that kind of sports. In infraspinatus, these can be figured out by the resistant flexion. This can be diagnosed by the resistance extension. And teres minor, both of them has almost similar functions, so infraspinatus and teres minor involvement can be diagnosed by this external rotation resistant external rotation. And subscapularis uh, can be diagnosed. Subscapularis, the function of the subscapularis is internal rotation and adduction and internal rotation. This can be diagnosed by a test called lift-off test. In lift-off test, we actually give the patient to put his arm backwards and try to lift off his arm, and we try to put some pressure. We try to put some pressure and tell him to hold on that position. If he cannot hold in that position, If the arm is fall down on the back, then it is thought that subscapularis is injured, and this rotator cuff muscle is innervated by cervical 5 and cervical 6. Now, muscles and the nerves. Supraspinatus muscle is supplied by suprascapular nerve, and the degree is 0 to 15 degree. Deltoid is supplied by axillary nerve, and degree is 15 to 19 degree, and trapezius is supplied by accessory nerve, and serratus center is supplied by long thoracic nerve. We, we are very familiar with that term, that winging of the scapula. Winging of the scapula happens due to um, damage of these nerve, due to destruction of these nerve, this long thoracic nerve, and the muscle involved is serratus anterior. You can easily remember by the SALT, serratus anterior, long thoracic, and winging of the scapula. Now, ARM. This is very highly. These upper extremity nerves are very, very important. In upper extremity nerve, first of all, we'd like to discuss about the axillary nerve. Before jumping into this nerve, first of all, we should know about the brachial plexus, but we are very familiar with the brachial plexus, so not to worry. Axillary nerve is cervical 5 and cervical 6. It happens due to fracture of the surgical neck of the humerus, fracture of the mid shaft of the humerus, and supracondylar fracture of the humerus. That means ARM. If you just think about the humerus, three part of the humerus, this is neck, this is mid shaft, this is supracondylar region, this is supracondylar region, mid shaft. So neck of the humerus is supplied by axillary nerve, and mid shaft of the humerus is supplied by radial nerve, and supracondylar fracture of the uh, humerus is supplied by median nerve. If there is fracture of the neck of the femur, then axillary nerve can be injured. If there is mid-shaft fracture, then radial nerve may be injured. And if there is supracondylar fracture of the humerus, then median nerve is involved. And neck of the humerus and anterior dislocation of the humerus. Neck and anterior dislocation of the humerus is the cause of injury of axillary nerve. And what will be the presentation? Presentation is, if you feel the deltoid, there is ups and downs in the deltoid. Deltoid muscle is not flat. If there is flattened deltoid, if there is loss of arm abduction at shoulder, if there is loss of arm abduction at shoulder, or loss of arm abduction at shoulder, if there is loss of sensation over the deltoid and the lateral arm, if there is loss of sensation over the deltoid and the lateral arm, then you can easily think that the injury might be in the axillary nerve. Then radial nerve. Radial nerve injury happens. Radial nerve is very important for the physical medicine and rehabilitation doctors, because it happens due to crutch palsy. We actually tell the patient to use crutch when they are unable to walk when there is problem in uh, walking, then we actually tell the patient to walk via crutches, and it happens due to crutches, or it happens sleeping with arm over the chair. Saturday night policy. If a drunk guy sit on the chair and sleep overnight, and the very next day he found it out that his arm is not working, then you have to think about the Saturday night policy. And other causes are repeated pronation and supination by the screwdriver use. The people who use a screwdriver, they are very susceptible of injury this radial nerve. Okay. The injuries above the elbow cause loss of sensation over the posterior arm, loss of sensation over the posterior arm and forearm, dorsal hand, wrist drop, wrist drop. Injuries below the elbow causes distal paresthesia without wrist drop. So if you find the wrist drop, then you have to think that the injury happens above the elbow. If there is no wrist drop, then you have to think about injury happens below the elbow, causes distal paresthesia. Triceps function and posterior arm sensation spared in mid-shaft fracture. Triceps function and posterior arm sensation spared in mid-shaft fracture. Injuries above the elbow causes Injury above the elbow cause loss of sensation over the posterior arm or forearm and dorsal hand, posterior arm and forearm and dorsal hand, and wrist drop, loss of elbow, wrist, finger extension with decreased grip strength. Strength. Uh, Now median nerve happens due to supracondylar fracture of the humerus. It is a proximal lesion of the nerve. Proximal lesion of the nerve. And median nerve. Another most high yield is carpal tunnel syndrome. In carpal tunnel syndrome, there is a in carpal tunnel syndrome and wrist laceration, distal lesion of the nerve. In median nerve, there is proximal lesion and there is distal lesion. The proximal lesion, there is proximal lesion. You have to think about supracondylar fracture of the humerus. If there is distal lesion of the nerve, then you have to think about carpal tunnel and wrist laceration. In median nerve, there is ape hand and hand of benediction, loss of wrist flexion, and function of the lateral two lumbricals. That means lateral two lumbricals, opponensis pollicis, abductor pollicis brevis, and flexor pollicis brevis. These are the muscles supplied by the median nerve. Opponensis pollicis, abductor pollicis brevis, and flexor pollicis brevis, and the first two lumbricals supplied by the median nerve. And if there is injury in the median nerve, it causes loss of function of these muscles, loss of sensation over the thinner eminence and dorsal and palmar aspect of the lateral 3.5 fingers with proximal lesion. Now, another important nerve is musculocutaneous nerve. It happens in upper trunk compression. Upper trunk compression. Uh, if there is injury in the musculocutaneous nerve, there is decreased biceps reflex, loss of forearm flexion and supination, loss of sensation, loss of sensation over the distal, over the radial and dorsal forearm, loss of sensation over the radial and dorsal forearm. Ulnar nerve, fracture of the medial epicondyle of the humerus, ulnar nerve fracture of the medial epicondyle of the humerus, proximal lesion, fracture of the hook of the hamate, fracture of the medial epicondyle of the humerus, proximal lesion, ulnar claw or digit extension, fracture of the hook of the hamate from the fall on outstretched hand and compression of nerve against the hamate as the wrist rests on handlebar during cycling, as the wrist rests on handlebar during cycling. In ulnar nerve, there is ulnar claw on digit extension, ulnar claw in digit extension, radial deviation of the wrist upon flexion, and decreased flexion of the ulnar fingers, abduction, adduction of the fingers, and thumb adduction, and the action of the ulnar to lumbricals. Action of the ulnar to lumbricals muscle. Loss of sensation over the ulnar 1.5 fingers, including the hypothenar eminence. Ulnar nerve is supplied by the hypothenar eminence is supplied by the ulnar nerve, and ulnar nerve happens due to fracture of the medial epicondyle of the humerus, fracture of the medial epicondyle of the humerus, fracture of the hook of the hamate, and compression of the nerve against hamate as the wrist, compression of the nerve against hamate as the wrist rests on handlebar during cycling, and the recurrent branch of the median nerve C5 to T1, superficial laceration of the palm, 8 hand, loss of thinner group of muscle, opposition, abduction, and flexion of the thumb, loss of sensation. This is axillary nerve, fracture of the neck of the humerus, fracture of the neck of the humerus. This is radial nerve, wrist drop, uh, mid-shaft fracture of the humerus, and median nerve is supracondylar fracture of the humerus. Ulnar nerve is fracture of the medial condyle of the humerus. Condyle of the humerus. Ulnar nerve, fracture of the medial condyle of the humerus. In ulnar nerve, there is intercostobrachial nerve, medial brachial cutaneous nerve, and medial anti-brachial cutaneous nerve. This is brachial plexus. In brachial plexus, there is root, trunk, division, root, trunk, division, cord, and branches. Root, trunk, division, cord, and branches. In root there is a long thoracic nerve. In root there is long thoracic nerve. In brachial plexus lesion, this is root, this is trunk, division, cord, and branches. Root is C5 to T1. In root, there is two branches, suprascapular nerve and long thoracic nerve. Arch palsy happens if there is upper trunk compression, that means C5 and 6. If there is lower trunk compression, C8 to T1, it causes Klumpke's palsy. In posterior cord actually divides into two parts, axillary nerve and radial nerve, and restroke happens due to the loss of this radial nerve function. And winging of the scapula is happened due to long thoracic nerve, serratus anterior, long thoracic nerve, and winging of the scapula. Axillary nerve involvement happens. Axillary nerve involvement causes deltoid paralysis. It causes deltoid paralysis. And radial nerve causes wrist drop, Saturday night pulse. And the musculocutaneous nerve, difficulty flexing elbow, and median nerve decreased thumb function and hand of benediction, decreased thumb function and hand of benediction. And in ulnar nerve, intrinsic muscles of the hand and claw hand, intrinsic muscles, the hand and claw hand. Trunk of the brachial plexus and the subclavian artery pass between the anterior and middle scalene muscle. Trunk of the brachial plexus and subclavian artery pass between the anterior and middle scalene muscle, and the subclavian vein passes anteromedial to this scalene triangle. Subclavian veins passes anteromedial to the scalene triangle. What happens in Erb's paralysis or Erb's palsy? Erb's paralysis, Wetter's tip. In Erb's palsy, there is compression of the upper trunk. In Erb's palsy, the causes of Erb's palsy in infants: lateral traction of the neck during delivery, In adult, trauma to the neck traction, and falling on head and shoulder in motorcycle accident. Falling on head and shoulder in motorcycle accident. These two things are the important cause of the Erb's palsy. In Erb's palsy, the muscle involved, we can remember the dib, herbs, gets, dips, on, tips. What does it mean? Herbs, get, dips, on tips. Dips means deltoid, infraspinatus, and biceps brachii. What is the function of the deltoid? Abduction. What is the function? What are the muscle deficit? Deltoid, infraspinatus, and biceps brachii. Deltoid, infraspinatus, and biceps brachii. And the functional deficit is abduction. Patient is unable to abduct, so arm is in adducted position. In the loss of infraspinatus, the function of this infraspinatus is external rotation, so he is unable to do internal rotation. Infraspinatus. In, infraspinatus is the function of the infraspinatus is lateral rotation or external rotation. So if there is loss of these infraspinatus muscles, lateral rotation cannot be done. So arm is medially rotated, and the biceps brachii. Function of the biceps brachii is flexion. Function of the loss of this muscles deficit causes flexion and supination. This is the functional deficit which cannot be done, and the patient is in opposite position. That arm is extended and pronated. So there is two things. One is patient position. Other, they cannot be done. Patient's position is adducted, so he cannot abduct. Patient position is medially rotated, so lateral rotation cannot be done. And patient position is arm is extended and pronated. Arm is extended and pronated, so uh, flexion and supination cannot be done. Flexion and supination cannot be done. This is high yield in Earth's palsy. In Klumpke's palsy, there is lower trunk compression. Uh, in in here again, two-part infants, upward force on arm, upward force on arm during delivery, upward force on arm during delivery, and in adults, grabbing a tree branch to a to break a fall, grabbing a tree branch to break a fall causes Klumpke's palsy. In here, the intrinsic muscles of the hand actually works. Lumbricals, interosseous, thenar and hypothenar muscle. Lumbricals, interosseous, thenar and hypothenar muscle. Lumbricals normally flex the MCP metacarpophalangeal joint and extend the DIP and PIP joint. DIP and PIP joint is extended. Lumbricals normally flex the metacarpophalangeal joint and extend the DIP and PIP joint. Then thoracic outlet syndrome. In thoracic outlet syndrome, there is compression of the lower trunk and subclavian vessels. In lower trunk and subclavian vessels, in there, it actually happens due to cervical rib. It happens due to Pancoast tumor. It happens in Pancoast tumor. In Pancoast tumor, there is winging of the scapula. If Pancoast syndrome, there is Horner syndrome, and there is thoracic outlet syndrome also. Same as Klumpke's palsy, atrophy of the intrinsic muscles of the hand, ischemia, pain, edema due to vascular compression. Then winged scapula. In winged scapula, lesion at the long thoracic nerve causes winging of the scapula. It happens due to axillary nerve dissection during mastectomy, axillary nerve dissection after mastectomy or stab wound. Wing of the scapula muscle involved is serratus anterior. The nerve involved is the long thoracic nerve. Inability to anchor the scapula to the thoracic cage. Cannot abduct arm above the horizontal plane. Above the horizontal position. Cannot abduct the arm above the horizontal position. Now, wrist joint. Now, wrist. Uh, there are there are 8 bones in carpal bones. She looks too pretty. Try to catch her. Scaphoid from lateral to medial. Scaphoid lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamlet. The first MCP area and the radius area is the scaphoid from lateral to medial. Uh, Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamlet. In scaphoid fracture, in scaphoid, palpable in the anatomical snap box, is most commonly fractured carpal bone. Scaphoid is the most commonly fractured carpal bone, typically due to fall on outside hand. Complication is proximal. Scaphoid fracture causes avascular necrosis. Do you remember the other bones, other area of the bone causes avascular necrosis? Scaphoid, talus, lunate, and the fracture of the neck of the humerus. Fracture of the neck of the humerus, condyle of the fracture of the neck of the femur, condyle of the femur, uh, fracture of the neck of the femur, condyle of the femur. Occult fracture not always seen on initial X-ray. If there is dislocation of the lunate, it may impinge the median nerve and can cause carpal tunnel syndrome. Fracture of the hook of the hamate can cause ulnar syndrome. Hook of the hamate can cause ulnar syndrome. Fracture of the hook of the hamate can cause ulnar syndrome. Fracture of the scaphoid, palpable in the anatomical snap box, is the commonly fractured carpal bone. Dislocation of this lunate can cause carpal tunnel syndrome. Compression of the ulnar nerve can cause a Guyon canal syndrome. Compression of the ulnar nerve can cause Guyon canal syndrome. Fracture of the hook of the hamate can cause ulnar syndrome. This is the hand, the muscle of the hand, thinner is supplied by median nerve, oponensis pollicis, abductor pollicis brevis, and flexor pollicis brevis. Then hypothenor is supplied by ulnar nerve, oponensis, digiti minimi, abductor digiti minimi, and flexor digiti minimi, flexor digiti minimi brevis, and dorsal interosseous, abduct, palmar interosseous, adduct. Both of them is supplied by the ulnar nerve. Opponensis pollicis first and second by the median nerve, third and fourth by the ulnar nerve, flex at the MCP, extend at the PIP, and DIP. Flex at the MCP, extend at the PIP and DIP. This is the pathophysiology of the claw hand. Now, distortion of the hand. In clawing, there are two types of claw: median claw, ulnar claw. And both median claw and ulnar claw happens due to distal nerve. Ulnar claw is supplied by the distal ulnar nerve. Median claw is supplied by the distal median nerve. Distal median nerve. Distal median nerve. Ulnar claw extending fingers at rest, extend median claw extending fingers at rest, extending finger at rest, and hand of benediction, making a fist of the six proximal median nerve, and of benediction, and OK gesture. OK gesture is supplied by proximal ulnar nerve. OK gesture is supplied by proximal ulnar nerve. So, distal ulnar nerve, distal median nerve, distal ulnar nerve, distal median nerve. Distal ulnar nerve causes ulnar claw, distal median nerve causes median claw, extending fingers at rest, extending fingers at rest, extending finger at rest, and the hand of benediction and OK gesture. Hand of benediction is the due to proximal median nerve, and OK gesture is due to proximal ulnar nerve. Atrophy of the thenar eminence in median nerve lesion, atrophy of the hypothenar causes ulnar nerve lesion. This is all about the upper limb anatomy. Inshallah, you will be benefited.